I'm Manny Thandery, the medical coordinator for MSF, responding to the flash floods here in KZN province. We are stationed at eThekwini and are providing relief and support to the communities affected by the floods. The most critical needs that we are seeing due to the flooding is threefold. One is the health needs, second is the water needs, and third is the sanitation issues. If water and sanitation isn't sorted out, you're going to have further health problems. The role that MSF is playing currently in the response to the flood is at a community level. We're helping 4 communities. We've set up kitchens, we've provided portable toilets, we've provided water, and we've provided non-food items and food items to address their needs. At the clinic level, we're also providing water by getting tanks in. We have also engaged the Department of Health and the Municipal Department of Health, and we are helping them with staffing and setting up mobile clinics and seeing communities that have been affected by the flooding. Most of them have lost their belongings, they've lost their chronic medication, and our team of doctors and nurses are going in and assessing their needs, providing them with their chronic medication in partnership with both the municipality and the Department of Health. And we are looking at providing this support until the community is able to get back on their feet.